The gastrointestinal system for nurses.
Hello everyone and welcome back to our series on physical examination.
Today, we will be discussing the gastrointestinal system. The gastrointestinal system, or GI system for short, is responsible for the digestion and absorption of food and nutrients in the body. In this video, we'll be discussing the anatomy and physiology of the GI system, how to perform an assessment of the abdomen, liver, spleen, and kidneys, and how medications can impact the gastrointestinal system.
Anatomy and physiology. Let's start with a quick overview of the anatomy and physiology of the GI system.
The GI tract begins at the mouth and ends at the anus, and includes several organs such as the esophagus, stomach, small intestine, large intestine, and rectum. The liver, pancreas, and gallbladder are also important accessory organs that aid in digestion.
The abdomen is divided into 4 quadrants: the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant.
The right upper quadrant contains the liver, gallbladder, and part of the small intestine. The left upper quadrant contains the stomach, spleen, and part of the small intestine. The right lower quadrant contains the appendix, cecum, and part of the small intestine.
The left lower quadrant contains the sigmoid colon and part of the small intestine.
The liver is responsible for producing bile, which helps to break down fats in the small intestine. The spleen helps to filter blood and remove old or damaged red blood cells. The kidneys are responsible for filtering waste products from the blood and producing urine. Assessment of the abdomen, liver, spleen, and kidneys. Now that we've gone over the anatomy and physiology, let's move on to how to perform an assessment of the abdomen, liver, spleen, and kidneys.
When assessing the abdomen, you want to begin by inspecting the overall appearance of the abdomen. Note any visible scars, hernias, or distension. Next, you will want to auscultate the abdomen using your stethoscope to listen for bowel sounds.
Normal bowel sounds are high-pitched, gurgling sounds that occur every 5 to 15 seconds. Absence of bowel sounds could indicate ileus, which is a blockage in the intestines. To assess for the absence of bowel sounds, you will want to listen for at least 5 minutes in each quadrant of the abdomen, as absence of bowel sounds in one quadrant could be indicative of a localized problem. After auscultation, you will want to percuss the abdomen to assess for any abnormal fluid or air-filled areas. Normal percussion should produce a resonant sound. Dullness could indicate fluid accumulation or an abnormal mass. Next, you will want to palpate the abdomen using your fingertips. Begin with light palpation to assess for any tenderness or pain. Then, move on to deep palpation to assess for any masses or organ enlargement. During palpation, there are several tests you can perform to detect abnormalities. Murphy's sign, assessing for tenderness in the right upper quadrant while the patient takes a deep breath. This can indicate cholecystitis or inflammation of the gallbladder. McBurney's point tenderness, assessing for tenderness in the right lower quadrant. This can indicate appendicitis. Bloomberg's sign, assessing for rebound tenderness by pressing down on the abdomen and quickly releasing pressure. This can indicate peritonitis or inflammation of the abdominal lining. When assessing the liver, you will want to begin by inspecting the abdomen for any visible bulges or enlargement. Then, place your hand under the right lower ribcage and ask the patient to take a deep breath. This will allow you to feel for any enlargement or tenderness in the liver. You can also perform the scratch test, which involves lightly scratching the skin over the liver to assess for any discomfort. To assess the spleen, begin by palpating the abdomen and then move your hand to the left upper quadrant. Place your hand under the left lower ribcage and ask the patient to take a deep breath. You should be able to feel the spleen enlarge during inhalation. Enlargement of the spleen can indicate an infection, inflammation, or cancer. To assess the kidneys, begin by palpating the abdomen and then place one hand on the patient's back and the other hand over the abdomen. Press down gently and ask the patient to take a deep breath. This will allow you to feel for any tenderness or enlargement in the kidneys. Impact of medications on the gastrointestinal system. Now, let's discuss how medications can impact the gastrointestinal system. Many medications can cause side effects such as nausea, vomiting, diarrhea, constipation, or abdominal pain. For example, antibiotics can disrupt the balance of bacteria in the gut and cause diarrhea, while pain medications such as opioids can cause constipation. It's important to ask the patient about any medications they are currently taking or have taken in the past, as this can provide valuable information about their gastrointestinal health. Additionally, certain medications can interact with each other and cause gastrointestinal side effects, so it's important to be aware of any potential drug interactions. In conclusion, the assessment of the abdomen, liver, spleen, and kidneys is an important part of the physical exam, as it can provide valuable information about the health of the gastrointestinal system. By following the proper steps and performing the appropriate tests, you can detect abnormalities and help guide further diagnostic testing and treatment. It's also important to be aware of the impact that medications can have on the gastrointestinal system and to ask the patient about any medications they are currently taking. Thank you for watching, and we'll see you in the next video.